This is LiveWell Talk on maintaining a routine for your child or children. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's Hospital. Day-to-day life has been disrupted like never before, all because social distancing measures to stop the spread of COVID-19. This lack of routine, coupled with the fear of the unknown, can be overwhelming for children as well as parents. Here to explain what parents can do to maintain a sense of normalcy for their children during this time is Josh Petersen, nurse practitioner at UnityPoint Clinic Pediatrics. Welcome.
Thanks, Dr. Arnold. This is a topic that's important to me both as a healthcare provider, but also as a parent. My wife and I have 5 kids, and so kind of working through some of these things at home as well.
What are their ages?
14, 12, 11, 7, and 4.
Wow, yeah, that's impressive. We could do another podcast on where kids come from, because apparently you and your wife need to, we'll say that for another podcast. But no, this is obviously disrupting. I have a teenage daughter who's a senior, her senior year. She's pretty laid back as far as what can you do about it, make the best of it. She's that sort of kid, but I can imagine it's hard for children to see the impact here. And I'm sure at first it was probably like a snow day and they were kind of excited, but now it's kind of worn on. So what are some of your advice you can give, not only for the children, but for the parents to maintain their sanity with the children?
Yeah, I think trying to establish some, routines are really important. There are, so many emotions and thoughts that they're going through, and that can create a lot of chaos for them. And they're used to a lot of regimen, with school. So one of the common questions that I get from parents is, what should we do at home, with the kids? And one of the things I like to start it with is what not to do. And you don't want to try and replicate what's going on at school, at home, because it's just not going to work. Most of us aren't teachers, and we're not in a school environment, so that can be really stressful to try and duplicate that. My kids have some great teachers, and they've sent home a lot of age-appropriate material for my kids to work on. But trying to figure out then how to incorporate in their lives I think is part of the challenge. What we try to do at my house is try and do 2 hours a day, usually from 10 to noon, where we do some dedicated schoolwork for them.
Okay.
Where they're working through some of the material that their teachers have sent home. For my older kids, it works pretty well for them to be pretty self-sufficient. But my younger ones, it's more of a challenge for them. We have to kind of work with them.
Sure.
And we have to remember too, with where they're at developmentally, that they need pretty frequent breaks, and that it works better for them to switch from, kind of one topic, to the next. But it can certainly create some conflict, at home that we're not typically used to, in trying to educate our kids at home.
Right. And then you never want to just throw in the towel and just let them watch Netflix all day.
Right.
It's too easy to do.
Yes.
Too easy to do. We've been doing, I haven't, the kids have, and my wife, they've been doing jigsaw puzzles. It takes up time, they do it together. I think that's a nice activity, and I'm sure we're too competitive in the Arnold household to actually play board games, because that's disruptive. The quarantine is much better. But what are some activities that you could do as a family to incorporate your kids outside of doing the schoolwork like you talked about, Josh?
Yeah, definitely. Yeah, I like to think of it as sort of learning or experiences that we can have with our kids that we're creating, these memories. So we like to try and be intentional with some of those creative activities, so we're not relying so much on some screen time. So you mentioned board games. That's one of our family's, favorite things to do is to work on board games. There's a big variety of them. One of my favorites is Settlers of Catan, so I rope some of my kids into playing that with me. But there's also some that the younger kids enjoy. We try to do some full family games of apples to apples, and it's fun. We laugh a lot together, create some memories that way. Another thing that we've tried to do is incorporate them with some cooking at home. Give them a chance to learn some of these skills in the kitchen.
That's a great idea.
They particularly enjoy making desserts, but it's still it's right.
You're learning measurements. You're learning units of measurement. You're following some sort of instructions. I mean, that's a great activity, and you're kind of distracting them with it's actually a learning activity.
Right, and then they realize what all goes into making food. Having to make sure they have everything on the recipe, following a recipe. And then, of course, they get the enjoyment of eating it afterwards. Yeah, so that's good. Our kids are pretty creative, so we try to encourage that. Another thing that we like to do is like write some stories. So we encourage them to, to write a story, and then we review it, read it with them, and get excited about it, which then makes them more excited.
Right.
And then encourage them to maybe even draw some illustrations to go along with it. So
As far as the routine, keep them in their same day wake sleep cycle
Yes.
as a school day. Is that your recommendation?
It doesn't have to be exactly the same, but don't let them stay up as late as they want.
Or
Don't let
sleep
them
till noon.
sleep in. Yes, yeah. I mean, it's important as good like sleep hygiene practices to have a consistent wake and sleep time. For my younger children, I mean, they naturally wake up at like the same time every day. So, if we were to put them to bed later, like they're just going to be grouchy. So
Right,
for
right.
those, we try to really keep to that same schedule. So that's my 7-year-old and my 4-year-old, keeping to that schedule. My older 3 kids, we do let them stay up a little bit later than they would typically on a school day. But then we also let them sleep in just a little bit later. But we try to have them all up and moving by 9 o'clock, so then we can start kind of that school portion that we do from 10 to noon.
It's been amazing. Dr. Bell and I were talking about this the other day. We have a lot of 7 a.m. meetings at the hospital, right? And a lot of those meetings have been either postponed or turned into teleconference. So you don't have this pressure to. Usually, I get here between 6 and 6:30 on a normal day. Sooner if there's something going on, but it's amazing how that just showing up here at 5 to 7 as opposed to 6:15 is like the night and day, And so, but you have to keep that discipline because we're going to have to go back to it eventually, or hopefully
Right.
soon.
Yes, hopefully. Yeah.
What should we be looking for as red flags that things maybe aren't going as well as they should be?
I think how our
I hate to talk
kids-
about the
yeah,
negative,
no,
but
no,
people
no,
need to know that.
I think that's important too. It's important to see how our kids are responding to all of this. I mean, kids vary in temperament, and some kids are pretty, laid back, relaxed, and they take things as they come. But other kids, they're wound a little tighter, and so they're naturally a little bit more anxious, and this can really set off a lot of their anxieties. So if you have kids that are really acting out, they are like isolating themselves. They're just anxious. I mean, I've had some of my patients be experiencing some panic attacks with this, and it's definitely something that you want to address. But I think it's important too that you're proactive in talking with your kids about what they are experiencing. What questions do they have about this pandemic? And if you do have a kid that's a little bit more anxious or even experiencing this extreme of panic attacks or not wanting to go outside, for these different fears, it's trying to get them the help that they need. So we've been able to do some like virtual counseling with some of these patients.
I was just going to ask,
Yeah.
Dr. Cleet Younger came on and we did telemedicine, virtual visits with this. What have you done in pediatrics?
Yeah, I mean, we're doing a lot of our, especially for kids that have any sort of ill symptoms, trying to do that more like telemedicine. But some of these mental health issues have come up, and it's also a good opportunity to do things virtually. Is with mental health, and so I've been able to connect some of my patients with counselors to learn some skills to cope with some of the anxieties. And we have had some patients that have needed to start some anti-anxiety medicines, and so just walking them through that process and kind of seeing how they respond to that.
As someone that's in the pediatric field, how do you make that? I imagine there's trepidation about putting someone on an anxiety medication because you hate to use the term, they may grow out of it.
Right.
Right. I don't like to use that term, whether it's asthma or anxiety, because you either have it or you don't have it anymore. You just, But so you probably have a lot of trepidation, a lot of hesitancy to do that, don't you?
Yeah, some of the things that we use to guide, the decision making and starting medicine is, certainly some screening tools, that then kind of give a number, give a a kind of assessment of where their anxiety is at, and so that factors into the decision making. Certainly, the parents, they're a good like source of how much is this anxiety affecting their life, and that's really the important is if this is affecting their everyday life and they're having this extreme of panic attacks, then it's time to try something to help them. And certainly we can always start with the the therapy piece with how do you cope with anxiety? What are some strategies? Some deep breathing, some corrective thinking. Some of those things can be helpful too.
And sadly, I think the economic impact is going to start is like is that snow day sort of mentality for the kids and the parents is ending, and you have this like economic tsunami that's probably coming, that's going to add to the stress, isn't it? So it's good to get out in front of it now.
It is. It is. Yeah. And children are perceptive, and
Oh,
so
yeah.
they
Oh, yeah.
know
Yeah.
when parents are stressed, even if it's not like directly communicated in words. I mean, they can tell
Absolutely.
when parents are dealing with stress.
Yeah.
So I know when I'm stressed, I'm more impatient with my kids. Like I yell more than I like to. I expect more of them. And then I start to see them like distance themselves from me. And that's when I realized, like, wow, I'm taking my stress out on my kids. And that, I mean, that's not a pleasant feeling to feel like, oh, man, I'm failing my kids.
Right. Absolutely. And you go through that denial, then acceptance and
Yes,
guilt, and whatever
yeah.
those 5 stages
Yeah.
are. I can never keep them in order, but I think everybody's going through a lot of those. One last question. This has been great information, but why pediatrics? How did you get into it? Tell us a little bit about yourself.
Yeah, I mean, I have always loved, children. Obviously, I have 5 children of my own.
Yeah.
Yes, yeah. But even like growing up, I worked in like an after-school program. Enjoyed, working with kids. I had decided, as a kind of a senior in high school, that I was going to be an anesthesiologist, and so then met a nurse anesthetist who said, "Well, nurse anesthesia is a good way to go."
Yeah.
So I went to nursing school, out of high school with the intent of being a nurse anesthetist. Well, it shouldn't have been a surprise that when I went through my pediatric rotation in nursing that I just absolutely loved it. And my instructor, at the time that did my pediatric nursing, she basically said, I mean, if you don't go into pediatric nursing, like, you're doing yourself a disservice. Like, I can tell you're passionate about this and you enjoy it. So
Well, good for you.
that's why I decided that, being a pediatric nurse practitioner is what I wanted to do.
Yeah, that's outstanding. I mean, any job that you have where you get up, you're excited to go, is just a blessing from God. It truly is.
Mm-hmm.
Well, that's really great information. Thanks for taking the time to talk about this. Again, this was Josh Petersen, nurse practitioner at UnityPoint Clinic Pediatrics. For the most up-to-date information on COVID-19, visit our website at unitypoint.org or the Centers for Disease Control and Prevention website at cdc.gov. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unitypoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.